edition of TCM Graduate TV. I'm Kenton Sefcik, registered acupuncturist. This is episode 41, and today I want to talk about the next heavy hitter on the stomach channel, Stomach 31. Now, the best reason to use Stomach 31 is for hip pain. And I have to tell you my hip pain story. So I was probably second year into practicing acupuncture, and I was no good at treating hips at all. And I was getting down about it. So I actually tried to think about a good way or a concrete way that I could turn this around for myself. And I decided that I was going to become good at treating hip pain. And I started incorporating this acupuncture point as well as some of these other ones that I'm going to share with you. Now, the hip joint is very, very large, and usually patients are telling us that it's sore on the side. However, we do have to diagnose. A lot of people say, my hip is sore, and what they really mean to say is that their sacroiliac joint is really, really sore, so we have to treat around UB53, maybe throw a cup on that. Anyways, so here we go, Stomach 31, really, really good for hip pain. Other acupuncture points that I'm using in the region for hip pain include GB29. So GB29 is midway between the head of the greater trochanter and the ASIS, and it's a fantastic acupuncture point to augment your treatment. Also, patients are telling me that they have pain in that area. Now, last but not least, we need to treat the actual joint. So if this is the joint, what we need to do is we need to take our time and find all the Asha points that are present in this joint, because the joint is so big and the tool we're using is so thin and small. It's really, really hard to treat this large joint with just one acupuncture needle. Now, I'm really, really big on not using a ton of needles in my point prescriptions. I like to keep them around the 15 or less mark. However, there's no hard set fast rules in Chinese medicine, especially with acupuncture, so we can adapt to the situation, and here's a way we can do it using needles around the hip joint. So I will push along the area, find out where the patient has pain. They'll say ouch, especially if there's a case of bursitis. And what we can do is we'll just put a pin there. And then we'll push along and we'll find out where they have pain elsewhere, and we can put a pin there. Now, let's say they have non-specific pain, as in what I'm trying to say is if you push on the area, it's not sore, but it's sore inside the joint. What I'll do is I'll circle my thumbs all the way around the joint, and I'll needle about 7 to 10 acupuncture needles circling the joint, such as this. Kind of like a sun. The other important factor is because it's a large joint, I think this is why some other health professionals prefer to use cupping, is because they see the lack of effectiveness in using maybe just a small tool. We can cup this joint. And what I typically like to do in this case is I like to put a needle in the center, and then I like to cup over top that needle. And that takes care of a lot of the hip pain, especially in bursitis. I have found, similar to cupping over top of lungs where there's fluid in the lungs, patients will blister on the skin. I have often pulled fluid out from underneath the skin when it comes to this bursitis. Of course, any type of joint pain, we can add influential of bone. And of course, we can offer some relief with influential of tendon, influential of muscle, GB34. I hope this helps you. I hope this helps you treat hips and makes everybody's hip pain magically go away. And I just want to remind you that safety is king, bedside manner is king, and results are king in that order. Thanks for hanging out with me, and we'll see you in the next video.